Hello, my name is Carl Shore. I'm a student at Southern New Hampshire University, and this is my practice patient for my patient assessment. And your name is?
David.
Okay, and David, do you recall signing a permission form for us to record this video?
I do.
Okay, and this video is going to be viewed by my instructor, possibly other students, and as we discussed, we're going to be uploading it on YouTube, so other people may view it as well. If this were a regular exam at a doctor's office, you would most likely be wearing a gown. For this exam, you're going to wear the clothes that you have on right now, and if in the office, I'd be wearing gloves, but for this exam, we won't do that. I'm going to wash my hands, and then we'll get started. I'm going to start by doing an assessment of your scalp and hair. Just looking for any lesions or bumps. If you feel any pain with anything that I'm doing, please let me know, or if you have any questions, also please let me know, and I'll explain things as we go along. Now, I would like you to smile and raise your eyebrows. Okay, I want you to close your eyes tightly and frown, and I'd like you to puff out your cheeks. Okay, very good, and I'm just inspecting around your eyes. If we were in a doctor's office, I'd have you read the Snellen eye chart from a distance of 20 feet to test for 20/20 vision, being your vision compared to somebody with normal vision at 20 feet, but we don't have that here. So what I'm going to have you do today is read a few lines of print with your glasses on, and just cover one eye and about a little bit closer maybe. Okay, and just read a sentence or two, please.
This kind of stress tears at the fabric of connection.
Okay, and then you can cover the other eye and read another sentence or two.
With the right tools, we can slow down, reconnect, and lead our kids to safety, happiness, and productivity.
Okay, very good. So now I'm going to do some testing of the eye. So I'm going to ask you to cover one eye and let me know when this pen light comes into your field of vision while looking straight ahead. Cover the other eye. Okay, very good. Now, uncover both of your eyes, and just follow the pen light for me with both your eyes without moving your neck. Okay, very good. Okay, now I'm going to look at your ears. And I'm going to do a whisper test, so I'm going to ask you to cover with your right hand your right ear. And I'm going to whisper something in your left ear, and I want you to repeat it for me, please.
21 football.
Okay, same thing with the other ear.
19 ping pong.
Okay, very good. Now I'm going to ask you to take your eyeglasses off for me, please, and I'm just going to inspect your eyes. Okay, and I want you to look at the wall behind me, and then look at the pen light. Okay, same thing, look at the wall behind me, and then look at the pen light. Okay, very good. You can put your glasses back on. And I'm just going to check your temporal arteries here. Okay. And I want you to open your mouth and close it. Okay, and I want you to push your jaw out, bring it back. Okay, now I want you to close your mouth tightly. I'm going to try and open it. good. And now I'm going to ask you to open your mouth and say, ah.
Ah.
Now lift your tongue up, way up into the side. Okay, to the other side. Now I want you to close your mouth and kind of peel back your gums. Excellent. Very good. Now I want you to take one hand and close one nostril, and then inhale and exhale. And do the same thing with the other side, please. Okay, very good. Now I'm just going to look at your throat here. Okay. And I'm going to palpate your sinuses. Any pressure or pain? Okay. I'm going to take a look. I'm going to feel your lymph nodes. I'm just going to take a look at your throat here, looking at you. Okay, very good. Now I'm going to check your carotid pulse. Okay, now I'm going to go behind you and I'm going to feel your thyroid gland. Okay, now swallow hard. Okay, and swallow hard again, please. Okay, very good. Now I'm just going to look at your back and your spine. I'm just palpating for any muscle tightness, spasms. Just going down your spinous process here. Okay, now I'm going to take a listen to your breathing on your back. Every time I move the stethoscope, I'd like you to take a deep breath in and out through your mouth. If you feel short of breath or lightheaded, please let me know and we can pause so you can catch your breath, okay? Deep breath in and out. Okay, very good. I'm just going to check for any tenderness here. Deep breath in and out. Excellent. Now I'm going to listen on the front. Same thing, okay? Okay, so I just want you to lean forward a little bit, okay, and don't breathe. I'm just going to listen to your heart for a moment. Perfect, okay. So what I'd like you to do now is lay back. And I want you to look over to your right. I'm just looking at your neck. Okay, very good. And look over to the left. Okay, relax. That's good. Okay. Now I'm going to listen to your heart. Okay. It may seem like this is taking a long time. Finding the landmarks. I'm going to start by taking your apical pulse for 15 seconds. And I'm just listening in different locations to appreciate your heart sounds. to do the same thing with the bell of the stethoscope. Okay. Now I'm going to listen about your aorta. I'm also assessing for any what we call bruits or thrills, feeling for any palpitations, checking your renal arteries, listening to them. Now I'm going to listen to your bowel sounds. I'm going to do something called percussion, which is just tapping in your tummy. Listening to the sound. Okay. Now, I'd like you to get up onto your left side, this side facing towards me, just like half a turn. Listen to your heart when you're in that position. Okay, that's good. Back to you. Okay, so now I'd like to check the range of motion in your hips. So if you could bring this leg all the way up as high as you can. Okay, and then bend your knee, bring it up towards your chest. Okay, very good. You can put it down. Do the same thing with the other leg. Bend your knee up, bring your knee up towards your chest. Okay, very good. Put your legs back out, please. Okay, now I'd like you to take your right leg, bring it out, and then bring it back over and cross over your left leg. Okay, very good. Do the same thing with your other leg. Out, and then back over. Okay, excellent. Okay, now I'd like you to, you can actually sit up now. Okay, now if you could bring your toes up towards your face, and then extend them down. Okay, and then bring them out, and then bring them back in. Okay, now can you make a circle with them without moving your knees? Okay, very good. And I'm just going to inspect your legs for warmth, hair growth. And can you fan your toes out and scrunch them together? Okay, very good. Relax them. Okay, I'm checking your capillary refill time. That's very good. I'm just going to rub something across the bottom of your foot. Okay. Now I'd like you to take your right heel and bring it down your left shin. Okay, do the same thing on the other side. Okay, that's excellent. Now I'd like to have you take your hands at your sides and then bring them up over your head and then bring them down together behind your neck. again, okay, and out to your side, and then up behind your back, as high as they can go. Bring them in close to your body. Okay, very good. Now bring your hands out towards me. Okay. So next I'm going to ask you to try and push your leg forward against my resistance. Okay, now bring it back towards you. Okay, very good. This one out. Okay, and then back towards me against resistance. Okay, I'm also going to check for pulses in your feet right now. Okay. Now I'd like you to take your head and bend your chin down to your chest. Bring it back, all the way back, back. Okay, towards neutral. And then turn your head to the left and to the right. Back to neutral. Okay. And now I'm going to ask you to pull your head back against resistance. Okay, bring it forward. Okay, try and bring your left ear to your left shoulder. Okay, same thing on this side. Okay. And then side to side, turn it towards my hand. And turn it away from my hand. Okay, very good. Now have you hold your arms out. Okay, just checking your arms. Okay, and I'm going to try and push them down. Don't let me. Don't let me bring them up. Okay, now bring your hands up like this. Okay, bring them out a little bit. Try and push them back. Don't let me. Okay, very good. Hold your hands out. Okay, palms down. Okay, I'm just checking your fingers. Good. Okay, and I'd like you to take your thumbs and then touch your fingers all the way down and then back again. Okay, excellent. And tap your leg back and forth. Okay, very good. I'm going to take your arm. I'm just going to check your pulse. Break your pulse here. Checking your lymph nodes and your elbows. Okay. On this side. Very good. Now, what I'd like to have you do, I'll have you stand up. Okay. And I want you to lean backwards, lean forwards. Okay. Very good. Stand back up. Okay. And I'd like you to twist back and forth. Okay. And now to one side and then the other. Okay, very good. Now I'd like to have you walk over towards the window. Turn around. And then on the way back, I want you to do a toe-heel walk, like you're trying to walk a straight line. Okay, very good. Now I'd like you to walk towards the window on your heels. And then I'd like you to walk back on your tiptoes. Okay. And now if I could have you take a seat on the table again, please. Okay. What I'm going to do is I'm going to ask you to close your eyes, and I'm going to put an object in your hand, and I want you to tell me what it is.
Key. Pen.
Okay, very good. Now I want you with your eyes closed, I'm going to touch you with the cotton ball, and I want you to tell me where I'm touching you, okay, with your eyes closed.
Left arm. Right wrist. Left shin. Right ankle.
Okay. Very good. Okay, now I'd like to have you stand up. Okay, and I want you to close your eyes. And this is called the Romberg test, and I'm just assessing your balance and staying still in place. Okay, very good. You can open your eyes now. Now what I'd like you to do is I'd like you to stand on one foot and bring the other knee up, and then do a shallow knee bend down. Okay, and can you do the same thing on the other side? Okay, I think we're done. Thank you very much for your help.